It's not uncommon for people who have hip pain and hip tension to have trouble opening up the hip, so getting into external rotation when they're in this flexed position. So what we can do is test it. Bring your leg into a figure four position and see how difficult it is to get that knee close to the floor. Then we take a resistance band or some type of strap and secure it to something. You're going to stick your leg inside the band, and you're going to get that resistance roughly perpendicular to the femur, so this long bone in the leg. And you're going to bring your leg into flexion. From here, you're going to use the band as a distracting force, so it should feel like it's opening up the hip and kind of trying to pull it apart. And then what you're going to do is, keeping that foot as flat as you can on the surface, you're going to work into flexion and then external rotation. So you're going to try and open up that hip in this position. You can work through different angles. As you explore, you're going to find the right spot for you where it feels the tightest and the most restricted. When you're in this restricted position, try and keep that foot flat, let that band pull the hip apart, and then start to work external rotation. You can find a tight spot and hold that position for a period of time, or you can do reps. So you can kind of get in and work it and see if you can get a little bit deeper. As you explore and you experiment, try different angles and different ranges of motion. When you're in these positions, you can try contracting. Just squeeze anything that feels tight, hold, 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 release the contraction, and then see if you can sink into a deeper stretch. When you're done stretching and mobilizing, we want to retest. So bring your leg back into the figure four position and see how it feels. You should notice some type of improvement.